What is Aucatzyl? Aucatzyl is a CAR T-cell treatment for acute lymphoblastic leukemia all in adults that is made by genetically modifying a person's white blood cells to recognize and attack leukemic cells. Aucatzyl Obicaptogene Autolusil is given as a one-time infusion. Aucatzyl's mechanism of action involves first extracting and concentrating the patient's blood cells, and then sending them to a specialized manufacturing facility where their T-cells are genetically modified to express an anti-CD19 receptor. These T-cells are then infused back into the patient where they engage and bind with CD19 expressed on leukemic cells, killing the cell and reducing tumor activity. Aucatzyl gained FDA approval on November 8, 2024. No REMS is required by the FDA for Aucatzyl. Aucatzyl is used for the treatment of adults with relapsed or refractory B-cell precursor acute lymphoblastic leukemia. Aucatzyl side effects. The most common side effects of Aucatzyl are fever 100 for F38C or higher, nausea, diarrhea, infections, headache, muscle or joint pain, fatigue, or feeling very tired, low blood pressure, dizziness, or lightheadedness, headache, fatigue, shortness of breath, fast, irregular heartbeat, confusion, difficulty speaking, or slurred speech. Low white blood cells can occur with a fever, bleeding. Serious side effects and warnings. Aucatzyl carries a boxed warning for cytokine release syndrome, neurologic toxicities, and secondary blood cancers. Cytokine release syndrome (CRS) is a potentially fatal, inflammatory immune reaction with symptoms that may include fever, headache, joint and muscle pain, low blood pressure, and organ failure in severe cases. Do not have Aucatzyl therapy if you have an active infection or inflammatory disorder. Immune effector cell-associated neurotoxicity syndrome (ICANS), which may be fatal or life-threatening, has occurred following treatment with Aucatzyl, including before CRS onset, concurrently with CRS, after CRS resolution, or in the absence of CRS. Tell your healthcare provider if you experience any neurologic events after Aucatzyl treatment, such as headache, dizziness, tremor, anxiety, sleep disturbances, and delirium. How is Aucatzyl administered? Before receiving Aucatzyl, your blood will need to be collected by a process called leukapheresis, which will concentrate your white blood cells and allow Aucatzyl to be made from them. The following 3 steps then take place. Step 1. Your blood cells will be sent to a manufacturing center to make your Aucatzyl. While waiting for Aucatzyl to be made, you may get other medicines to stabilize your cancer. This is so that your acute lymphoblastic leukemia does not get worse. Within 7 days before you start treatment, a sample of your cells will be taken to confirm your disease burden. This will determine which infusion dose you are given first. Your infusion dose will be tailored to the burden of your disease. This will be provided as 2 separate infusions. Step 2. Before you receive Aucatzyl, your healthcare provider will give you chemotherapy for a few days to make room in the bone marrow. When your Aucatzyl is ready, your healthcare provider will give it to you through a catheter tube placed into your vein. Intravenous infusion. After you receive your Aucatzyl first infusion, you will receive your second infusion 10 days, 2 days later. 30 minutes before you are given Aucatzyl, you may be given medicines for fevers such as acetaminophen. Step 3. After your Aucatzyl infusion, you will be monitored daily for at least 14 days after the infusion so that your healthcare team can closely monitor your recovery. You should plan to stay close to the location where you received your treatment for at least 4 weeks after getting Aucatzyl. Your healthcare provider will help you with any side effects that may occur. You may be hospitalized for side effects. Your healthcare provider will determine when you can go home. Your healthcare provider will want to do blood tests to follow your progress. It is important that you do have your blood tested. If you miss an appointment, call your healthcare provider as soon as possible to reschedule. What should I avoid after receiving Aucatzyl? Do not drive, operate heavy machinery, or do other dangerous activities for 8 weeks after you get Aucatzyl, because the treatment can cause sleepiness, confusion, weakness, and temporary memory and coordination problems. Do not donate blood, organs, tissues, or cells for transplantation. What other drugs will affect Aucatzyl? Tell your healthcare provider about all the medications you take, including prescription and over-the-counter medicines, vitamins, dietary supplements, and herbal supplements. Aucatzyl ingredients: active ingredients, Obicaptogene Autolusil; inactive ingredients, Albumin. Human DMSO. Aucatzyl is a cell suspension for infusion that contains a total recommended dose of 410 by 106 CD19 CAR positive viable T cells supplied in 3 to 5 infusion bags.